afternoon, everyone, and a very warm welcome to today's health webinar. We are delighted to have you all join us for this insightful session. Today, we'll be addressing two very important topics that affect our everyday health and well-being. Our first session is on why are heart attacks among young people on the rise by Dr. Vinod Vadhya, who's an interventional cardiologist who will share valuable insights on the alarming increase of cardiac issues in younger age groups and how we can take preventive steps. Our second session is on oil consumption and metabolic health by Dr. Ravi Kiran, General Physician and Diabetologist, who will guide us on the impact of oils in our diet and their role in metabolism, diabetes, and overall health. So we encourage all of you to stay engaged, make note of key takeaways, and feel free to post your questions in the chat box. Our experts will be addressing them during the Q&A session towards the end. So without further delay, let's begin with the first session. Please join me in welcoming Dr. Vinod Vadhya. Doctor, please go forward. Thank you.
Thank you, Ajay sir, for your warm welcoming note. So, why are heart attacks among young people on the rise? Post-COVID era, there are a lot of young people are getting attacked by these heart attacks. So basically, first we need to know about the heart. First, what is about heart? There is a William Harvey, an English physician, was the first to decide completely about heart and detailed system circulation and properly told being pumped by the heart to the other part of the body. So, out of 4.7 liters of the blood flow through the heart, it pumps the nutrients to the 300 trillions of arteries, and there is average human heart beats more than 70 minutes per hour, and 6 liters of blood. Heart circulates blood through every minute 60 minutes. Human heart is around 20 grams, 200 to 450 grams. However, it's 300% to percent varies. So, heart disease in young adults. Cardiovascular disease is the leading cause of death in the world, second most common cause of death, and 80% of the cardiovascular disease due to coronary artery disease in these developing countries. Large body data says that on CAD, but little data on premature CAD on young patients. So, what are the risks of cardiovascular death? I think it zoomed out. Can you make it small?
Yeah, it's coming back, I guess.
So what are the risks of cardiovascular disease? There is a aging, genetic, lifestyle, smoking, diabetes, hypertension. So mainly hypercholesteremia, smoking, stress, thyroid disease, genetics, lifestyle modification. These are the main risk factors. So coming here, so type of heart disease. What are the heart diseases? Young adults getting affected. Aortic disease, vascular disease. We can divide into two. Aortic disease, aorta and related branches is a normal aorta. You can see here, and this aorta with large abdominal aneurysm. You can see here. And coming to the vascular system, what are the diseases we can see? So how to prevent cardiovascular disease? Reduce hypertension, have blood pressure regularly, check up. If screening blood pressure is value is more than normal range, go for screening maybe regularly. High blood pressure can kill the patients. It can kill silently. So be careful of hypertension. So what about the reduce the risk of diabetes? Diabetes is the most common cause of death. So when compared to other diseases, diabetes is the most common. What are the diabetic related complications? We can see diabetic retinopathy, diabetic nephropathy, stroke, cardiovascular disease. Among 8 to 10 individuals having diabetes, those are having these cardiovascular events. Diabetic neuropathy, these are the main heart diseases we can see. What about other preventive factors? So body weight is very important. You can calculate your body mass index more than 25 or higher. It can be very high. Patient may have diabetes and obese index related issues can occur, and consumption of food can be increased, and diabetes related things will be very dangerous. So nowadays we can say that I am young, I don't need to worry about heart disease. This was the last, but nowadays this scenario totally changed post COVID. So young people are more affected, so be careful. And while choosing your food is the most important. There are a lot of junk foods nowadays we can see. So choose your food that are low in calories, low in unhealthy cholesterol. Eliminate trans fatty acids, fat from your diet. Trans fat, most type of fat that's linked to the main uh, killing, which can increase our blood pressure and elevate our heart diseases. So avoid red meat, full fat dairy products, fried foods, packaged foods, and those are marinated foods, processed foods. These are foods we cannot use. And flaxseed to your diet you can add, and it can increase fibers, and it can reduce low cholesterol. So third most is the fifth most is regular exercise. Regular exercise, it prevent your blood pressure and other comorbidities. It helps to maintain your proper body weight. So brisk walking for 20 minutes a day is very good, important. And coming to the salt is the main source of hypertension, where patients having a lot of salt. When we're going to the uh, having food at outside restaurants, or we are fancy about taking a pinch of salts or pepper on the tables, we should avoid those things. So main source of sodium is can come from the sodium glutamate. This so intake of the sodium, processed bread, cheese, bottled sauce, and ready made meals. Limiting the amount of salt in it can save the millions of the heart. Next most is the smoking. Smoking is main cause of young adults are getting affected by the heart attacks. It is the first most we can cause stress, smoking, and diabetes. Smoking, it can start clotting tendency. It can increase clotting tendencies. So stay away from the smoking. It contains nicotine, which can blood vessels will be affected. It's being forced to your increase the blood flow to harder. This leads to an increased blood pressure and elevate your uh, cholesterol levels. So eliminate exposure to products including chewing, gums, and all. Then comes to yoga. Identify the situations where you are feeling very stressed and try to eliminate them. So daily regular walking and exercise, yoga, meditation, aromatherapy, this can be uh, used for to avoid the stress. So take measures to improve quality and ensure that sleep and each night. Limit caffeine consumption. So after 2 p.m., try to go to sleep early nights and regular your sleep. Exercise regular to boost your heart. Drinking alcohol is generally not harmful, we can say, but pinch of alcohol, small drop of alcohol also not good for health. So limit your alcohol and stop. That's better thing. That's it. Thank you.
Thank you very much, Dr. Vinod, for the informative session. I'd like to pose a question to Dr. Vinod. Dr. Vinod, can genetics play a stronger role than lifestyle in early heart attacks?
Yeah, there is a coming to the literature. What we have seen previously, those patients had heart attacks in family history. When patient had family history of heart attacks early, like 40 years of family history, sudden cardiac arrest will be there. So familial, from father to then next generation to next generation. So when we compare to other associated factors, but family history plays a major role. When patient having family history, we need to evaluate whether really family history. We need to go for genetic evaluation. Suppose the patient of heart disease, homocysteine levels are very important in patients of cardiac problems. So homocysteine, we need to go for regular checkups if patients having family history of heart disease. And suppose the patient having sudden cardiac arrest in the family, so cardiomyopathies we can call it as. So in those patients, so we need to thoroughly evaluate for go for MRI test, and some genetics associations will be there. We can go for that. So coming to the point that family history, when having the clear family history, go for family evaluation first. So all the generations we need to evaluate step by step. And coming to the other risk factors, these are the major role nowadays. Post COVID era, there are a lot of stress and smoking, lifestyle modification need to do, sleep disturbances, mobile usage, these are the major nowadays. So when families it is a strong, definitely we need to evaluate, we need to focus on that.
Okay, thank you, doctor, for that. I have another question though. What preventive health checkups should young adults consider for their heart health?
Yeah. uh, Earlier, before 10 years, before COVID era, we can say earlier, after 50 years we need to go for checkups. But now, even though after 20 years of age we are seeing a lot of heart attacks, young heart attacks. So to prevent these type of scenarios, we need to go for regular health checkups. Like, don't think about your age. Age is just a number nowadays. So think about your risk factors, where you're working, what is your lifestyle. So go for regular blood tests. What are the risk cardiac related? So now I have seen a lot of patients having bringing a lot of investigations, like 30 pages of books from the small diagnostic centers. We don't like those type of investigation, fancy investigation we won't write. What are the specific investigations, like diabetes is there or not, family history is there, go for homocysteine. If you're a smoker, go for homocysteine levels. And ECG, basic ECG is the mother of all diagnostic cardiac problem. Mother is ECG, basic ECG. Then go for 2D echocardiogram. Then if these two are normal, even though you're having doubt, you're having pain, go for TMT test. Treadmill test is a very important. After TMT, is it possible, whether it is positive or not? Then go for, if it is positive, go for CT coronary angiogram is the next step by step. You can't go directly, you can go for coronary angiogram. Coronary angiogram, when when we are suspecting patient might have some disease, then only we can advise coronary angiogram. But before that, young patients, TMT, CT coronary angiogram, these two are very important, we can suggest. And remaining blood tests we can suggest.
Great. Thank you for the very informative answer, Doctor. Dr. Vinod, there is a question from Priyanka. She asks, is stress a major reason for sudden heart attacks or sudden cardiac arrests in young adults?
So coming to the young patients, uh, sudden cardiac arrest are, we have seen some patients. There might be some underlying process going on over the period, not one night, whether patient had arrest or whether whatever it is, but overlying period, like almost 6 months of period or 1 year period. There are warning signs must be there. So whether patient under stress, proper food is not taking, whether lifestyle is not good, he's under stress, or uh, whatever the previous, suppose any family history previously. So whatever these factors, apart from these factors, when patient under too much stress, whatever these factors will aggravate. And on this aggravation, there might be sudden formation of the blood clots. Blood clots will aggravate and suddenly blockages will occur. So there won't be one night blockage, so there might be process. So this could be, we can, what could be the underlying blood factors, we can say. What are the blood changes, what are the cholesterol changes, what are the homocysteine levels. So we need to know that. So before that, so we need to go for proper workup. We should take care of our body health, mind, everything we should take care. And we can prevent the heart attacks in young patients.
Are there any other questions? Thank you, Doctor, for all the informative answers. Else, yeah, yes, there is one more. This is for Dr. Vinod. Is thyroid a big issue for cardiac?
Yeah. Thyroid. When coming to thyroid, uh, it's a thyroid gland. It's controlling our metabolism, whole body metabolism controlled by thyroid. When thyroid abnormality is there, like hyperthyroidism or hypothyroidism, whatever the condition, so in this condition, these thyroid, it balances our body hormones, it balances our all other hormones, vitamin D, vitamin B12, whatever the, and lipid profile, these are correlated, with thyroid. When thyroid abnormal, there might be definitely changes in lipid profile. So when lipid profile is higher side, we can suspect heart issues, so we need to focus on thyroid definitely.
Thank you, doctor. Thank you very much. So we come to the close of today's webinar. And thank you, Dr. Vinod and Dr. Ravi, for such insightful answers and keeping everyone engaged. Before everyone leaves, we'd like to request you all to take a moment and fill the post-webinar survey that will pop up shortly after the close of today's session. It'll also be in your email after the session ends. So your feedback is very valuable to us in planning future webinars. So once again, thank you all for your time and participation. Stay healthy, stay safe, stay happy, and we look forward to seeing you all at our upcoming sessions. Thank you.
Thank you.